Over the years, Barbados has revised its public health surveillance and clinical procedures to improve the national response to infectious diseases like H1N1 and Ebola. Two key departments are the ambulance service and port health. First medical consultant for the emergency ambulance service, Dr. David Beyer, outlines that in the event of a suspected case of Ebola, a person could present in different ways.
Basically, any presentation of Ebola will likely occur at one of the ports of entry, whether at the airport or the seaport. And whether it's at the airport, will be on a plane, or whether in terminal. Also, in terms of the seaport, either on a ship or in terminal or on the environs, I suppose. In addition to that, if persons who would have come into Barbados during the incubation period and then they get ill in country, we anticipate that we may have transfers from residences, hotels, homes, villas, or people may opt to go to a medical facility, whether private or public, and then we need to transport those to care as well.
The requirement for an ambulance responding to a suspected case of Ebola is that the patient's quarters are separated from the driver's compartment.
And there were 2 vehicles in our fleet which fit that mold. In addition, we wanted to have a vehicle which was easily clean post-patient exposure. And the actual 2 vehicles that we chose, actually, they do fit that criteria as well. So we have one as the primary and one as the backup.
Acting Environmental Health Specialist Port Health, Stephen Hart, explains that for some time, persons, not only in the health sector, but also at the ports, have been trained.
So currently, there are 3 points of entry identified to the World Health Organization. Right? Those are the Grantley Adams International Airport, the Bridgetown Port, and Port St. Charles. Vessels going directly to Port St. Charles, there's an environmental health officer stationed there to clear those vessels. Vessels go into other ports, which are the Arawat Cement Plant and Port Ferdinand. Those would be cleared at the Bridgetown Port before they actually go on to their designated port. We work as a team. Everyone on the team has been trained to identify whatever public health emergencies occurring at any given point in time. You would have this training, and then from there you should be able to handle most, if not all, of the events that are occurring at the point of entry.
He explains some of the scenarios that could occur and the protocols which would be activated.
We've had protocols prior to 2003 where you had the emergence of SARS. Since then, we've reviewed those protocols for H1N1, pandemic, even influenza. That was done in 2009. And after that, in 2010, we also did a review of the current protocols for the airport in conjunction with the National Civil Aviation Organization as well as the local Civil Aviation Organization. And with those protocols, we also had GAINC in their immigration and customs. The ones for the airport, they deal with actually from the time someone becomes ill on the aircraft. There are a set of IATA protocols whereby the crew on the aircraft should isolate that person. If they require masks, they should be given masks and isolated to area in the aircraft which is away from the other passengers, and they would have a separate toilet facility for use. From there, the pilot should notify the nearest tower, whereby from there then the tower would notify the health agency and the airport authority, and from there those would then notify the relevant stakeholders at the airport. In the Bridgetown port, the procedure is that ships which are arriving in port, they should notify of whatever health events are occurring on board 24 to 48 hours before arrival, and then that is followed up with an email 1 hour prior to arrival on the morning that they actually arrive.
Acting Environmental Health Specialist Port Health, Stephen Hart, explaining the plans that have been put in place to respond to public health risks as the Ministry of Health continues its action plan to combat infectious diseases.